Hi, usually do this presentation in a continuing ed program for professional continuing education credits for healthcare providers. So I'm used to doing something really long, and I talk and I flap and I do things like that. So if I stay back here with my speaker notes, are you going to be my friend back here?
Yeah,
That's okay.
I'll be back here for a while. I'm just making sure it works for.
I'm just checking. I want to make sure I don't get too off on storytelling and forget to talk about the things that I really wanted to address. I am a nurse by background. I'm certified in rehabilitation nursing and board advocacy. Why am I not advancing? What?
So you can click through on this and let me slide over the captions real quick, so the audience can see them. Should be good. Let's see.
I broke it again. There, no, I didn't move.
Okay.
I haven't moved. Thank you. Always laugh when you can. It's cheap medicine. I just like this quote, so I throw it in there. I started to say I'm a nurse in rehab and board certified in patient advocacy, but I actually my specialty area is in serious illness, chronic conditions, specifically end of life care. You're not going to die because I have a hospice background. You were going to anyway, but probably not today. So I don't actually give off anything contagious about that. But I want to talk a little bit about humor. Humor is important to me. I think it's important to all of us. And I think it's just a great way to normalize the abnormal. It's a way for us to break the intensity of things that are going on around us. And quite frankly, when we're laughing, we get to be back in control. It helps us gain control of what's going on around us. There is a secret society of happy people. I'm not making this up. Pam Johnson is their founder, and she's done a lot of research and study on happiness and humor. And we all have in healthcare over the last 2 decades because of the role it plays in our life experience, in our quality of life, in our management of anxiety and self-care and depression issues going on. There's a lot of reasons we look at it, especially with resiliency. And one of the things that she found, which I would agree with, is that we seem to be very comfortable airing our dirty laundry, but not so comfortable talking about the good things in our life. I know more about Brad and Jolene's divorce than I do about my own. And I don't know that that's healthy to be that involved in other people's crap, quite frankly. And we all know when stuff hits the fan, it's never distributed evenly. So, rather than spraying ourselves with that, maybe we could revisit what we can control and work on that. There is also an International Congress of Humor out there. I don't know what they look like. There may be one in the room today. They're very secretive, I believe, but they count us. They count how many times a day we smile and how many times a day we laugh. There's probably other creepy people out there counting other things, but someone is out there looking at this, and they have found that, and this was done right before COVID. So I'm thinking it's a little bit different now. And it was probably hard for them with the mask to even keep counting. So I don't even know how that worked. But the studies showed that 64% of us were smiling less than 20 times a day. When you add up how many minutes and hours there are in a day, that's not very much. They also found that it changed when we were at work. When we were at work, we decreased the smiling less. The study showed that 72% smiled less than 20%, 20 times when they were at work. We also found as a result of that about half of the people said their lives were out of balance, and almost 70% of them said it was because of their jobs. And that may be unchanged or even worse now that so many people are trying to balance working from home. And really what we know about multitasking, which tends to happen when you work from home, is that we just do more stupid things faster. It's not that we're more efficient or anything else. And in healthcare, we often deal with situations where people are concerned about whether or not we have a right to be happy, whether or not we have a right to even celebrate a holiday or a birthday, an event that we're enjoying, our favorite team winning. Unless you live in Kansas City, obviously we have to enjoy that. We've had a few good years, but it impacts us in such a way that we feel like we're not even allowed to smile or laugh because somebody else has something bad going on. And yet that's really not the intent of living. The intent for most all of us, regardless of our situation, is to find some joy, some respite in there. This is one of my favorite slides. It's my presentation, so I get to put in there what I want. We all talk about how we're too busy to do things. We're too busy to work out. It's funny that people drive to a gym and all of these things because you have your legs, you can use them at home. But as my younger daughter pointed out to me, bitching about my weight was not an aerobic activity, despite the effort that I was putting into it. So, laughter actually has great benefits to our health and exercise. You know how they have the acronym texting, LMAO, laugh my ass off? You really can't. Apparently somebody's out there studying this, and if you laugh 100 times, it is the equivalent of 10 minutes on a rowing machine or 15 minutes on an exercise bike. Plus, the physical relaxation and decrease in muscle tension that you get from laughing lasts for about 45 minutes. It's totally free. You can do it anywhere you want to. It also helps us with like an inner body workout because of the effects on our diaphragm and on our abdominal muscles. So you could laugh yourself into a six-pack if you tried. It also improves your digestion. It stimulates oxygen intake and your circulation. It also secretes catecholamines, which are your alertness hormones. If you do it right, you're either gonna, wash out your eyes or it'll run down your legs, but something's definitely. It lowers your stress hormone cortisol, and this is a huge big deal because cortisol is very bad stuff. In large doses, cortisol is toxic to your brain over time. It stops your digestion, which makes you constipated, which makes you cranky. It causes muscle tension. It contributes to ulcers, to diabetes, to memory loss. All of those are bad things. But one of the things that we know about women, not that I want to, show this to everybody, but with women, just the visualization of stress causes us to start releasing the stress hormone cortisol. Not saying that some of you guys don't, but I think most women would agree that their tolerance for messiness is a little lower than what their male counterparts tend to be. So when you look at the stress hormone cortisol and the effects on women on our bodies, it tends to make us put on belly fat, which is not only unattractive, it makes us grouchy. It also increases our risk of heart disease, and all of the effects with your abdominal girth are attributed to an increase in heart disease issues. So don't do it. Okay. Stress hormone was meant to be your fight or flight. You're out being a hunter or a gatherer, caveman days, you hear a woolly mammoth stomping through the forest, you suck in your gut, you hide against the side of the cave, it goes by and you go back to hunting and gathering. But today we live at a heightened state all the time. So instead of having a cortisol level like this that occasionally spikes, we live with a cortisol level up here that is constantly doing this all of the time. That's not good. So again, it's controlling what we can. My daughter sent me this because she said, yeah, 100%, this is you. Laughter decreases, again, those stress hormones, but it also increases your immune cells and your infection fighting antibodies, and that's going to improve your resistance to disease and to infections. It also reduces allergic responses, even seasonal hay fever type of symptoms. And it is contagious. If you laugh, other people are typically going to laugh along with you. It reduces your blood sugar levels and it increases your body's ability to to manage increased glucose. So even in a diabetic or a non-diabetic, it will help you to maintain a more consistent blood sugar level. And again, it just plain old makes you feel better and you look better to other audiences. Once in a while, I'll end up doing one of these presentations in an audience of older people, and afterwards someone will come up and tell me how much they enjoyed it. And I think, really, I couldn't tell, because the whole time they're looking out there, especially as we age, we lose the collagen in our face. So we just start sagging and we're just down here all the time. Well, it just puts us into this perpetual frown, and you always look like you've got resting bitch face all the time. And it's not pleasant. And we actually use more muscles to do that than we do to smile. So when we hang like that all day long, we are training our face to look like that. So you got to practice smiling. Sometimes when I'm driving, I just do this to try and lift my face a little bit. And then you catch somebody at a light and you're like, "Guy, what do I do now?" Do I just go all in and side again? All right, this lady's pain she describes, it actually starts in her husband's back where it moves up his spine, out his mouth, through the air and into her ears, and that's what causes her headaches. There is a huge connection actually between laughter and pain management. Now, not only is it a great distraction, because distraction is a great non-pharmacological, non-medication way to deal with your pain, whether it's sleeping off a migraine or a hangover, or whether it is just finding something on TV that interests you. It's a great way to divert your attention. We know that the release of endorphins and serotonin are going to decrease the anxiety that we experience, and it's going to boost our body's feel-good natural chemicals. But endorphins also help to promote not just that overall sense of well-being, but pain relief. And what they have found is that laughter for 10 minutes has the same effect as for over about 2 hours as taking morphine. And the way they did this was in a study of individuals who had knee or hip surgeries. And by introducing the use of comedy and distraction, by letting them select something to watch, not only did they have something to do other than push that call button, which is a nurse, I can tell you, is the worst invention they ever came up with. You can't get a darn thing done because those patients are always hitting their call lights. But while they're distracted and watching the movie, they're laughing, so they're exercising, they're deep breathing, and we want you to turn and cough and deep breathe and move around, get all that anesthesia out of there, wake up your GI tract and your bowel and get it going, decrease the risk of pneumonia and wounds and urinary tract infections. But the patients actually ended up decreasing their use of morphine post-operatively by 61%. Just by introducing laughter into their recovery period. It also protects your heart. It does that by improving the function of your blood vessels, and it increases your blood flow, and that helps protect you against heart attack and other cardiovascular problems. And again, when we're lowering our blood pressure and improving our circulation, helping lower those stress and cortisol levels, we're decreasing our risk of heart attack and strokes as well. We also know that heart disease in the studies on resiliency have shown that people with a lower tendency to laugh compared to a sense of humor compared to others of their age were 40% more likely to have heart disease, which brings in the question, do sourpusses get heart disease? Or, and I kind of fall into this camp, does having a chronic condition, a chronic disease, a progressive illness take away some of your joy? And I think that's a normal response to something, kind of like a diagnosis when they say, well, depression is something you commonly see in someone with Parkinson's or a cancer diagnosis. Well, no kidding. This isn't good news. Yes, that's kind of a normal response to those things. And when you think about it symbolically, speaking of the heart, most of our mental and physical illnesses, one of the first things that you notice about the person is that they're just not happy. They've lost their joy in living. R&R, relax and recharge. Laughter helps you reduce your stress and increase your energy tremendously. You stay focused and you accomplish more. You can cry yourself to sleep, but you will not laugh yourself to sleep. It just does not happen. It makes you feel good, and that feeling remains with you even after the laughter subsides. So if you share a joke like this with one of your family members before all of those goony relatives show up, you guys can make eye contact across the table every now and then when someone says or does exactly what you'd been talking about earlier was going to happen. And you get to re-share that sense of joy and laughter and relaxation all over again. And it's more than just a break from sadness and pain. It gives you courage and it gives you strength to get through the rest of that holiday afternoon. And it's important because we need to have those looked forward to opportunities. It also helps you shift your perspective. One of the things that humor does is it lets you put something out here until you're ready to deal with it. That's called denial. And if you leave it out there all the time, it's a problem. But sometimes we just need to get used to it and figure out what it is and what we're going to do to it. That shifting our perspective, that psychological distancing keeps us from being overwhelmed, and it gives us some distraction from whatever the crisis that's going on at hand is. And that helps us to feel a little safer and less awkward. One of the issues with humor is its ability to help us speak our truth. It releases some of our inhibitions and it lets things rise to the surface where we can say them in an appropriate way. You can sandwich something important between a couple slices of humor and put it out there where the other person might be able to hear it and receive it in a way that's a little better than having the same conversations in an angry tone that's accusatory or pointing out what someone has continued to do wrong again. But it's powerful, it's effective, it helps you with healing resentments, hurts, disappointments, disagreements, all of those things. And it helps you to bond with people. And when we bond with them and we build more and more of that resiliency and more of that positive action with each other, we're more able to handle the ups and downs that come with relationships and working things out with people. It's a very good way to deal with being emotionally healthy. And that link between laughter and joy is very close. Furiously Happy is one of the books by Jenny Lawson, who's one of my favorite authors. And you know right from the get-go that she's a cocktail of mental health disorders. She's got several books, and there's a great story that goes with this raccoon, but I chose him for this because humor is a blessing. We need to count them. This is something that the Secret Society of Happy People encourages us to do, is to keep a humor journal. And when you do that, you have the opportunity to have what they call a happiness challenge and revisit the joy in your life over and over. If any of you have ever had one of those nights where you sit there and play crap through your head over and over that went on during the day that didn't go well, and pretty soon you start looking at things and saying, you know, if I'd only been wearing this, if I'd only said that, if I'd done it this way or that way, it would have turned out differently. What if instead of replaying all that negativity and setting off all those hormones and body chemicals, we know from PET scans that when we reimagine a motor vehicle accident that we were in, while we're doing the scan, the same areas of our brain light up as if we were in the accident at the time. So the reality is, you know, what you put in is kind of what you're going to get out. It's your thoughts, it's your choice. But if you took the time to record something positive, like maybe you could fit into your jeans, maybe they zipped. That's a double. You know, if you keep track of things that are positive, then you have the chance to revisit those and feel those good things over and over again. I don't write mine down, but I do use my phone, and I voice text myself things. And it gives you a chance to look back at things that are just pleasant and humorous and that bring you joy, that you're grateful for. You know, when we're in a state of sadness, we've got further to travel to get back to in a place of joy. I'm not ignoring you. I really am tying down. Think about people. People do the same thing. Remembering somebody you're grateful for. Today, I am wearing a piece of something I could fit into, a piece of jewelry from each one of my daughters, because I've had a really rough 48 hours. And I just needed their support. And I've had it. I think there's an intervention coming that includes not just taking away my throw rugs, but several things. I'm a faller, I'm a frequent faller, been falling for years. I have been looking for a few months at moving into a 1 level because I wanted to do it on my own time, and finances would be better if you choose it ahead. And I missed the boat. But the other night, and apparently one of his mice got loose in my garage. So while I was putzing out there, I brought my cats out, and one of them was in the attic, which of course has a pull down ladder to get up to it. Got music playing, even borrowed a beer from my neighbor because I was out. And so you know where this is going, right? So I'm bringing this, Jerko alley cat down from the attic because he's terrified and won't come down the ladder. This guy, I've seen him bring birds, jump up out of the prairie grass and bring birds down out of flight. I've seen him, kill squirrels, a whole squirrel. But no, we can't walk down a ladder. So I get down a couple of steps and I lose. And I'm laying on the garage floor thinking, man, this one may be a problem. This one, this one's going to be an issue, which is why today I have also, to remind me of joy, my sushi roll. My sister came over yesterday to wash all of the bodily fluids, as we call them, bloodborne pathogens out of my hair and stuff so I could come to the dinner last night. And her grandson, my great nephew, made me a padded sushi roll finger protector because my hand's a little bit of a mess and there's some other bruises there. And we opted to glue my hand together because sutures would have been hard to use it, but they stapled my head together. But I have a thicket of hair. So if you happen to lift this up in the back, you'll see a big old bandage that's covering a bunch of staples holding my head together. So I've had a rough week and I just needed some reminders to make me feel better. If you want a quick fix, Rutgers University did a study that showed the easiest way to get a woman to smile was to give her flowers. And I believe in this, and I keep fresh flowers in my house at all times. If something doesn't bring you joy, you shouldn't have it in front of you. Ask my ex-husband. Oh, wow. 6 times more likely in the presence of one other person, but laugh 30 times more likely in the presence of a group, which is what we're hearing from each other today. Last night, I don't know if others noticed this or not, but people in the restaurant got up and shut the sliding doors to where we were eating. Who would have thought that it would have been so loud and boisterous and so much laughter coming from this type of a group? Oh, if I ever bring toast at the group time, well, that'll be a real winner. It's so loud and laughing. This is good. This is good stuff. All right, and I want to close with this one because this is my favorite. I mean, is that not perfect?
Can we see the bottom?
Yeah, yes.
Oh, you can't. See it.
I know one uses it husband.
Husbands. Laughter is a birthright. It's innate. We come. It's built in. Infants start smiling in the first weeks of life, and within the first months, they're laughing out loud, and it's a whole body laugh. It's gelatinous. Everything gets in with it. We know from these people that are out counting with their little clickers, children smile and laugh on average over 400 times a day. No wonder they can't get anything else done, as a weight. But no, when you look at it, when we focus on our problems, we become the problem. If we take a childlike approach to it, children play with their toys. They play with their problems and they figure out a way to overcome them. They figure out how to deal with the grouchy sibling or getting in trouble or the bully at school. And they don't care that Barbie's 12 inches and Scooby-Doo is, 24-inch stuffed animal. That's her dog, it's fine, but they play with their problems and it gives them a chance to practice so that when they go back and deal with that person, they've already done some role playing and they're more prepared. if we would do that a little more and follow a child's way of doing things, of getting outside of the box and not becoming the problem, we might be able to solve them better. I'm going to stop, but I do want to share this one quote because it was really profound to me when I wrote this presentation years ago. It's from a gentleman named Scott Burton. He was dealing with stage 4 osteosarcoma, which bone cancer, and stage 4, not good. That's the highest number. He was young, married, had a couple of kids. And he said, the other reactions to my disease, the anger, the depression, the suppression and denial, each one of those took a little piece of me. Each one made me feel just a little less human. But laughter made me more open to ideas, and it made me more inviting to others and even a little stronger inside. And it proved to me that even though my body was devastated and my spirit was challenged, I was still a vital human being. About 10 years after that, maybe I'm pushing it, maybe it was more like 5, but at my age, it was probably 20 because you can't count them anymore. I was at a event and there was a motivational speaker there, a guy that did a bunch of comedy and magician stuff and everything. And as he kept talking, suddenly it all just clicks like one of those Tetris games where the blocks fall in. It was Scott Burton. I had assumed when I wrote this presentation that that was one of the last profound epiphanies he had and that he had died. And I was wrong. He's out there now as a motivational speaker for people, not just in the mainstream and not just for those in the healthcare industry, but to help empower all of us that are in this situation, individuals with diseases or illnesses and family and friend caregivers. And I just think that's just one of the most cool things ever is that I got to meet him in person. So, thank you for letting me do this.